So thank you again for being here today. Could you provide more information about your organization, your role, and why this work is so important to you?
So I work in two different spaces. One is as the director of the Office of Cancer Health Equity at the Wake Forest Baptist Comprehensive Cancer Center, and the other as the chair of the North Carolina American Indian Health Board. In both of those roles, I work with community to try to address issues around health equity and health disparities, and particularly focused on the 8 recognized tribes and 4 urban Indian centers in the state of North Carolina. So we really, this work is important to me, both personally as an enrolled member of the Lumbee tribe and professionally in my passion for working with Native communities to try to develop strategies to understand what health disparities exist and how to address those disparities.
And can you talk about the presence of the Indigenous Native community in your region?
So as I mentioned, North Carolina has 8 recognized tribes. One of those tribes, the Eastern Band Cherokee, is the only federally recognized tribe. We also have 4 urban Indian centers in our 4 largest cities in the state. So we have actually, North Carolina has the largest American Indian population east of the Mississippi River, and ranks in the top 10 in the number of people who identify as American Indian or Alaska Native in our state relative to the other states in the United States. And so we have a wonderful Native presence in our region, in our state. And so it gives us lots of opportunities to work and lots of in rural and work with rural tribes, with urban tribes, and with a federally recognized tribe with the Eastern Band Cherokee.
And what work or activities are you currently collaborating with this community?
So we are currently working on a number of initiatives. We are collaborated with colleagues here at Wake Forest School of Medicine who developed a tribal health assessment. And so they went to each of the tribes and the urban Indian centers and basically held talking circles in collaboration with tribal health ambassadors that were hired to work on the project with our collaboration, and put together a report to provide back to the tribes and to the urban Indian centers, and giving a sense for what are the major health issues that are impacting the tribal communities. Obviously, that work has been greatly impacted by COVID-19. So we've had to make some adjustments to that. We've also done a lot of education in areas around cancer, around COVID-19, and also in working in areas around cultural humility.
And to your knowledge, what has the historical relationship been like between the Indigenous Native community and health systems in the area? Have there been some examples of challenges and barriers to building trust?
There are obviously there's a difference in the way that Native communities and health systems interact with each other depending on the setting. The Eastern Band Cherokee have a wonderful health system that is tribally operated, and their new Cherokee Hospital was planned and developed with input from the community. So they have a really nice system in place there for the tribes. The non-federally recognized tribes, their engagement is basically with the local health systems, the hospital, the primary care providers, the health departments. And so oftentimes those relationships are a bit challenging because oftentimes those communities are relatively small, and there's the challenges of having those health systems having staff that are trained to work in these spaces with Native communities, so that can, present a lot of challenges. I would say too, that the other thing that you will see is that obviously there are issues around racism and discrimination that occur in health systems, and so those types of things can destroy trust, and takes a lot of time to regain that trust. And so to the extent that health systems can work to approach in Native communities with a sense of cultural humility, with culturally appropriate training, and implementing best practices in those communities, that will go a long way to helping to break down those barriers.
How does your agency work with Indigenous and Native communities, and how did you start engaging them?
So we work through primarily working through tribal leadership. So the place that we start is working with the tribal administrator, the tribal chief, the tribal council, the health committee, or the whatever structure the tribe has for addressing health priorities. We also work through, our state has a Commission on Indian Affairs that works at the state level in the Department of Administration. So we work with that organization. And so it's really going to the trusted entities within those tribes, but also trusted entities statewide. We also try to make ourselves present, and so we're at cultural events, we're at the statewide conferences that focus on Native health issues or Native issues in general. And so we make sure that we are seen, and that we are a trusted resource for the community. So that's really the way that we start the engagement process, is working through those trusted agencies within the tribes and across the state.
And what have you learned about engaging with them and building trust?
One thing that I've learned is that you can't take anything for granted, that you have to understand that because maybe something I see by looking at data and thinking that this might be an important priority, maybe is not the issue that is most important to the tribe. So not taking those issues for granted, but also listening, being very understanding of what the challenges the tribes see. And I think also looking at those social determinants, those things that are really the upstream factors that contribute to the disparities that we often see in communities. So things like jobs and employment and education and access to care, all those things. Those I think are really, really important issues that tribes try to deal with. And so trying to help understand the role of those social determinants on the health of the community, I think is a very important component to building trust.
And what are some cultural considerations that health departments or organizations should know about if they want to engage with this community?
Well, I think they certainly need to know what are the health priorities of the tribal communities. So, one of the things that health systems, health departments are required to do is to do community health needs assessments. And so when you do that, making sure that there is involvement in the tribal communities in your service area, I think that's very important. I think the other thing that's important is to understand the views around health and wellness. So if you understand how a tribal community conceptualizes health and wellness, then that will give you a better understanding of how to address those needs. And I think the other thing that's really, really important is that making sure that the people, the tribal community sees you. So when they have cultural events, when they when they have when there is space for you to be involved and engaged, then you need to be present there. So when there's a powwow, when there's a cultural event, you need to be there and let them see you. So that's so important in this engagement process.
And where would you recommend health departments start when outreaching to Indigenous and Native communities? Are there specific agencies or organizations that would be best?
Well, I would say, again, so starting with tribal leadership. So if you are in this, if there are tribal communities in your service area, connecting with the tribal leadership, understanding how, in a respectful manner, how you engage with the leadership is very important. And I would say also, if there are trusted organizations within the community that you can engage with, that would also be very important. So if there's in addition to the tribal council, the tribal government, if there are tribally run agencies that you can connect with, then I think it would be very important to start that communication process, and do it in a way to where, you know, it's clear that you're not coming to instill your values on the tribe. It's that you're there to listen, to be respectful and mindful of the concerns that the tribal community has, and how best to work together to address those issues.
Are there processes or policies within your organization that needed to be updated or adapted while you were working to engage the community?
Um, to an extent. I mean, obviously with COVID, we had to make adjustments in how we engaged with the community, just from the perspective of being respectful to the health and well-being of the community during a pandemic. But I would say also, I think understanding how the communities were responding to, because you can be in a situation where you're kind of constantly focusing on the negative, and talking about disparities. But if you can sort of bring it around to look at issues of resilience and look at issues of equity, then I think you will be much more successful. And that's what we've tried to do. We've had big challenges in trying to look at data to try to document some of the disparities, particularly with mental health and oral health. There's just not a lot of data on these issues for our tribal communities, but we've had to ensure that the tribal community understood that these are important issues and that we can work on trying to address those issues.
I just want to know if you had any final thoughts or key points that you really wanted health departments to take away from this conversation when they move forward to engage with tribal communities.
I would just say, that I am very grateful for the work that local health departments do, and particularly now with COVID and the shift that these health departments have had to make. And so I would just, encourage you to be diligent in working with tribal communities. It is oftentimes a wonderful experience to learn about a new culture and learn about some of the challenges that other communities face. And so when you do that in a in a manner that is culturally respectful and culturally, there's cultural humility there. I think it can be very rewarding. And so I would just, encourage you to learn as much as you can and to be as diligent as you can in that process.